Hello, this is Dr. Behnam. I'm a board certified dermatologist, and today we are going to be talking about acne scars. I know you've probably seen a lot of my videos about acne scars with respect to TCA Cross technique, subcisions, as well as lasers. And in majority of my videos, I always say that when patients come to me, they've already done the lasers and they have not really seen much of an improvement. Well, there are a lot of reasons for that. One, a lot of our patients are kind of olive skin tone, so you can't really, hit it with the lasers aggressively. And a lot of patients also have deep acne scars that are resistant to lasers. So in my office, when somebody comes in, lasers are usually the last choice, last step that we do. So we always look towards other alternatives to treat the acne scars without the lasers. So one of my favorite procedures is TCA Cross, and I have tons of videos about that. TCA Cross is a high density chemical peel that we apply specifically to acne scars, where it's going to stimulate basically collagen production. And another procedure that I like is subcision, where we take a needle underneath the skin and go back and forth and try to really open up like a lot of those acne scars, especially the ones that are resistant to lasers, and especially the ones that are very deep. I've started to do a lot of what we call mega sessions, where we combine multiple of these procedures all in the same day, where patients come in and we numb the face and we do subcision, followed by PRP, followed by TCA Cross, all in the same day. And we really see very good results in those cases. I'm gonna demonstrate and show a patient of mine where we did multiple different procedures and we kind of ended up using laser towards the end of the procedures to really smooth out like a lot of her acne scars. So this is a patient who came in, and I'm also going to put her photo up as well. So she came in, she had a lot of deep box scars along with rolling scars and some ice pick scars, kind of combination of everything. This is a patient who is actually an ideal patient for what we call the mega session, where you come in and kind of combine multiple procedures all in the same day. She is kind of olive skin tone, Indian descent. So she came in, and this is what we did. The first time we saw her, we decided to do a TCA Cross technique, and I do TCA on darker skin individuals as well. I just haven't pre-bleached. So we saw her initially, she went home with a bleaching cream, she used it for several weeks and she came back, and we did TCA in all these deep ice pick scars. Then she came back for a second session for our mega session, where we did subcision. So we numbed the area, we did subcision where basically with a 20 gauge needle we go underneath the skin and try to open up like a lot of these acne scars, and during that session as well we did another TCA. Then she came back for the third session, where we did just a regular TCA session. And then we finished this off with what we call the Vivace laser, which is a radio frequency microneedling. So we did the Vivace on her, and we did PRP right afterwards. And there are two ways to do the PRP. One, since the Vivace, the radio frequency microneedling, creates a lot of tiny holes, so one, we apply the PRP on top, but also I literally inject the PRP into the skin, what we call intradermal injection. What you're trying to expand that skin tissue basically vertically, and by expanding it, you're also expanding the scars as well. So by doing, if you look at it, by doing the subcision, where you're trying to treat the acne scars, the tethered scars that's pulling down on the skin, those are deep scars. The PRP is treating basically the skin, the scars within the skin intradermally, and the TCA is treating the superficial scars basically on top. With subcision, we're trying to attack the deeper scars. Those are the tethered scars that are pulling down the skin. With PRP, we're trying to attack the scars within the skin, trying to expand that scar intradermally, and also is supplying the skin with collagen and your own growth factors. And with the TCA, you're hitting the scars basically on top of the skin. And when you do the Vivace laser, basically you're hitting causing collagen stimulation at many different levels of the skin, because the Vivace is done at 3 different levels in the skin. So in this case, again, she's had the TCA, multiple sessions. She's had one subcision, as well as to Vivace's. So now I'm going to show you the after photo. So this is how she looked afterwards. Look, her skin, first of all, is glowing. It's a lot more radiant, and a lot of those acne scars, they're much smoother. I'm not saying they're not there, but it's definitely, they're not as deep, they're a lot shallower, and basically with lasers, basically it's also gonna get smoother as well. So I think overall, basically she's done really well. So she's someone who's darker skin and who really can't do all the lasers available to patients that are lighter skin color. If she was lighter skin, I will actually do a CO2 laser on her and really try to smooth out like a lot of those shallow scars as well. Okay, have a nice day. Thank you so much.